This is Duke University.
Let me first introduce Jonathan Katz. He's the writer-in-residence at this Humanities Institute and a regular contributor to the New York Times and the New York Times Magazine, as well as to publications including The New Republic, The Guardian, Foreign Policy, Politico, and The New Yorker Online. With grants from the Pulitzer Center on Crisis Reporting, and he is a frequent guest on radio and television, including the BBC, CNN International, and NPR. But here at FHI, we really know Jonathan through his work on Haiti. Jonathan was an Associated Press correspondent in Latin America and the Caribbean at the time of the earthquake in Haiti. So he is a survivor of that earthquake. And in the course of covering the aftermath of the earthquake, he identified he really saw, named, and identified the history of the cholera epidemic that broke out in 2010 in the fall after the earthquake. And I'm sure that the question of the journalistic interface with infectious disease epidemiology and with the politics of the movement of disease through vulnerable populations will come up in tonight's conversation. And you all can read about that experience of Jonathan's in his award-winning book, The Big Truck That Went By, How the World Came to Save Haiti and Left Behind a Disaster, which is published by St. Martin's Press in 2013 and was a Penn Literary Award finalist, winner of the Overseas Press Club of America's Cornelius Ryan Award for the year's best book on international affairs. Jonathan also specifically won a journalism medal for his coverage of the origins of the cholera epidemic in Haiti. And he has been one of the important journalists on Zika. He has also had Zika in Haiti in this semester. So the question of environments that we don't often hear about, Zika, Haiti is really living in a cloud of fear because Zika is very prevalent there at the moment, but it's too early to really know what the consequences will be in Haiti. So I will let Jonathan now, before we move on to the bios of our visiting journalists and of Dr. Chris Woods, I will let Jonathan say a couple of words about what he plans to do with the Journalism and Media Initiative.
Okay, we'll get to you guys in a second. We'll be right with you. Hello, everyone. Nice to see you. Thank you all for coming out here today. Yes, I'm very excited to find out what we do with the Media Initiative as well. It's still very much in its larval stage, it is something that is still to take shape and figure out how long it's going to be around for and how successful it will be, which just makes it very much part of the journalism environment in 2016. One of the things that I really want to do with this is to, and this is what we're going to do a lot here in the event today, is really get into how the sausage is made. What journalism is, what journalism is all about. It's an interesting moment for a lot of people, especially those of you of the undergraduate persuasion. I think we're probably consuming more news per capita than at any previous time in history, and yet trust and understanding of journalism as an institution, along with all of our other major institutions, is probably at an all-time low, which is something of a paradox, and it's something that I'm hoping that we get to explore both specifically here today when we talk about what the impacts of journalism have been on the Zika epidemic and vice versa, and then in general as the program goes on. So I'm looking forward to working with a large and diverse group of people, undergrads and grads and people here at FHI and whoever else happens to walk into the room. And I'm very excited to have this first event.
Wonderful. Okay, so keep an eye out for opportunities to work with Jonathan. I will now give the bio for Patricia Campos Melo. Patricia, thank you so much for joining us. We're thrilled to have you long distance due to the urgency of political matters in Brazil. Patricia Campos Melo is an editor at large with Folha de Sao Paulo and a columnist with Folha.com who covers international relations and global economics. She has written 2 books in Portuguese, and I wonder if I could ask Christine to read the titles of the books.
I'm going to actually pass it to Julia, whose Portuguese is probably better than mine. Índia, da miséria à potência, India from Misery to Power, Editora Planeta, and O Mundo tem medo da China, The World is Afraid of China.
Thank you. She has also worked as a reporter with Valor Econômico and Gazeta Mercantil, 2 daily financial newspapers in Brazil. Patricia has a master's degree in business and economic reporting from New York University, where she received the New York Financial Writers Award. She graduated in journalism from the Universidade de Sao Paulo. She speaks fluent English, German, and Spanish, in addition to Portuguese. And we will learn from her tonight how, despite her focus on international relations and global economics, she found herself reporting from the teeth of the Zika crisis in Brazil. And Simon Romero became the Brazil bureau chief for the New York Times in November 2011. In this role, he covers Brazil and several other countries in South America, including Argentina, Chile, Paraguay, and Uruguay. He joined the paper in 1999 as a contract writer in Sao Paulo, Brazil, where he covered economic issues and was based there until 2000. Before joining the Times, he was a senior writer at the America Economia in Brazil from August 1998 to March 1999, covering economic and political issues for Latin America's leading business publication. He has also served as a staff correspondent in Brazil for Bloomberg News, opening its bureaus in Brasilia and Rio de Janeiro, and wrote about Brazil's economic stabilization program, Elections, Crime, and Corruption. He was born and raised in New Mexico and graduated cum laude with a degree in history and literature from Harvard College. He has held a Ford Fellowship in Business Journalism at the University of Kansas, and is fluent in Spanish and Portuguese. So he clearly is a journalist who is familiar with all of the different systems of logic and institutions around a broad swath of the world. So thank you so much for joining us, Simon. I will quickly also introduce Dr. Chris Woods, who should hopefully arrive soon. He attended Yale University and pursued his medical education and training at Duke University and public health training at UNC Chapel Hill. He is a graduate of the Epidemic Intelligence Service of the Centers for Disease Control and Prevention, where he served in the meningitis and special pathogens branch of the National Center for Infectious Diseases. He formulated his interest in global health at Tenwek Hospital in Bomet, Kenya, during his internal medicine residency. While at CDC, Dr. Woods performed programmatic work and outbreak investigations throughout the US and the developing world. Dr. Woods has published over 130 peer-reviewed articles and has a particular interest in the development of medical microbiology capacity in the developing world and the epidemiology of emerging and re-emerging infectious diseases. He is the co-director of the Hubert Jürgen Center for Global Health and a professor in the departments of medicine and pathology at Duke University, as well as an adjunct professor in epidemiology at UNC, and the Emerging Infections Program at the Duke National University of Singapore Graduate Medical School. Clinically, he serves as Chief of Infectious Diseases and Clinical Microbiology and Hospital Epidemiologist for the Durham VA Medical Center. He also serves as the Director of Graduate Studies and the Masters in Science for Global Health at the Duke Global Health Institute, where it is a privilege of mine to be a colleague of his. So I'm sure that he will be with us at the first moment that he is able to. So I will let you
Wonderful. Thank you very much for the beautiful introductions. Thank you, guys. Hello. I don't know. I'm turning around like as if I'm actually looking at you, but I don't think you can see me. But I am looking at you right now. We're making eye contact. Okay. So this is a media initiative. So before we get started talking about Zika, we actually have some news to break. At 5 p.m., so I guess about 20 minutes ago now, the CDC announced that it has concluded, after, quote, careful review of existing evidence, that Zika virus is a cause of microcephaly and other severe fatal brain defects. They're publishing an article in the New England Journal of Medicine that is supposed to, I think, also drop at about 5 o'clock, although on the conference call earlier, they said that they were having some technical issues, so at least we're not alone. Anyway, this is interesting. It's an important development, and it answers one of the questions that was going on for a long time at the beginning of the epidemic, which was just trying to figure out what we were actually talking about. Because one of the things that we're going to discuss right now is that all of us in the journalism world, also a lot of people in the medical world, considering that this is a new disease on this side of the Atlantic, kind of had to jump straight into the deep end covering this thing before anybody really knew anything about it. But as CDC indicates, it does seem that we're getting more information. Although I heard some chatter on that same conference call wondering why the World Health Organization has not yet come to the same conclusion, so stay tuned. This epidemic was a surprise, as epidemics tend to be. In retrospect, as news often is, we can go back and sort of see and imagine reasons why it might have been likely that something like this would have happened with global warming, with the expanded territories of mosquitoes and things like that. But that said, at the very beginning of this thing, like as with any epidemic, as with the cholera epidemic in Haiti, as with any epidemic, no one knew what was going on. And one of the first roles of journalists is to figure out the answer to that question. And that's why we have two people who were involved in that very process here with us today. So Simone, I wanted to start with you and see, in the spirit of showing a bit about how the sausage is made, if you could tell a little bit about how you first came to cover this and how you and your editors at the Times decided that this was a story worth pursuing in the first place.
Your question is a great one. I first learned about Zika and its connection to microcephaly one morning here at my home in Rio de Janeiro, when I was reading the morning papers with my wife, Carolina, who's Brazilian, and she said, "Hey, look at this. Look at what's happening up in Bahia and up in Pernambuco, two states up in northeast Brazil. There are all of these reports of this birth defect, microcephaly, which very few people, quite honestly, had heard of. I had never heard of it before. And all of a sudden, around late November, early December, in the local media and somewhat in the national media, there was an increase of reporting on this, and so it immediately caught my attention. Brazil, of course, last year in 2015 was enduring an incredibly debilitating epidemic of dengue, another mosquito-borne fever. More than 800 people in the country died as a result of getting dengue last year. São Paulo, the biggest and most prosperous state in Brazil, was the epicenter of that epidemic. But it was clear that something different was happening up in northeast Brazil. This wasn't dengue. Epidemiologists, infectious disease specialists at the University of Bahia and at Fiocruz, this really renowned, amazing research institution, were able to identify what was happening in Zika and make the link to microcephaly. And they were seeing this alarming surge in cases. So I started researching this more thoroughly throughout December, and then at a time that's normally a lull in terms of news in Brazil, at the last week of December, we ran a front page article on what was happening. And it was just sort of like trying to piece together a puzzle, a mystery in a sense, because so much was unknown. Brazil had never had exposure to Zika before, so very, very, very little was known about the virus itself or the connections that were being made by researchers to microcephaly. But in the course of reporting on what was happening, we started finding out that Zika was connected not only to microcephaly, but to Guillain-Barré, which is this debilitating syndrome that causes temporary paralysis in people. It's really quite terrifying. Some people are completely shut in for weeks. They lose complete control over their emotions for quite some time. And so throughout the month of January, it was just this race to try to find out as much as possible about Zika, about microcephaly, and about just the other complications caused by the virus. It was sort of a process of cross-pollination in a way, relying, of course, on sources on the ground, medical professionals who were rushing and trying to figure out what was happening in their own right, reports in the Brazilian media, talking to specialists in the U.S. and in Europe, trying to find out the origins of the outbreak. So it was one of those uneven processes where hopefully we were able to fill some gap in finding out what was happening.
Great. And thank you very much for that. Patricia, I was wondering if you could tell us a little bit about, from the Brazilian perspective, how quickly did it become clear that this was a major story in Brazil, and how did the news media react when whatever information it was that got your attention started coming out?
Sure. Thank you for the invitation. It's really an honor to be here. Thank you so much. It's a pity I couldn't make it to the States, but as Simone said, it's really complicated times here in Brazil right now. And I just wanted to add that I usually cover international issues, right? So in that sense, I covered the Ebola outbreak in 2014 and 2015 in Sierra Leone. So then when they started talking about Zika, and I'm going to tell you guys, it took a long time, even for the Brazilian press, to start paying attention. I remember in May 2014, the then Minister of Health, Arthur Chioro is his name, he went public to say that Zika is not a concern. Zika is a very mild disease. There's nothing to fear about Zika, and dengue is our main concern. We're having several, mainly dengue causes, it's deadly, and Zika is not, so please don't panic. That's what he said. That was May 2014. Then in beginning of September, end of September, beginning of October, we started to see, mainly in the local press in Pernambuco. Pernambuco is a state in the northeast of Brazil, and there until now, it's where we're finding the most cases there. And we started seeing, at first, it was just, there was nothing, it was a qualitative thing. The doctors were describing this huge surge in the number of babies born with microcephaly in the hospitals in Pernambuco. And this was very strange, and they started speaking. So slowly, people started to pay attention. But the national newspapers in Brazil, they were not covering it in a decent way until the end of October. So then, for instance, our newspaper, Folha de São Paulo, is the largest daily newspaper in Brazil. We were covering with the local correspondent up until December. In December, we sent a reporter from São Paulo, that's the head news office, right, São Paulo, to Pernambuco to cover it. And then in February, I went there with a photographer to do a special issue on Zika in Pernambuco, which is still the epicenter of the outbreak. And the whole time, and I think Simone noticed it, and it's still, I think the biggest problem in this coverage, the Zika virus coverage, is that the numbers, data are absolutely, you can't trust them. I mean, there's no data whatsoever because in most of Brazil, there's only, it's only possible to diagnose dengue virus and not chikungunya or Zika virus. And the symptoms are very similar. So basically, we work with the number of cases. The Ministry of Health talks about 500,000 to 1.5 million. That's like a huge difference because they have no idea how many Zika cases we have.
So you touched on an interesting point that I think sometimes gets missed when people are watching news coverage from the States overseas, which is that not only is the world a very big place, but other countries, especially Brazil, are also very big places. To what extent do you think the fact that these cases of microcephaly, the places where Zika seemed to be hitting hardest, were in the north of Brazil, were in an especially poor region of Brazil, which of course helped promulgate the disease. The fact that it was a part of the country that was far away from Sao Paulo and Rio, that it was a poorer part of the country, the impact that had on the initial news coverage and also the seriousness with which the government took the problem.
Absolutely. Yeah, you're totally correct. Because it was not in the centers, in the main industrial financial centers of the country, was in the Northeast, which is one of the poorest areas in the country. News media and most of the media outlets are based either in Sao Paulo or Rio de Janeiro. They're just not paying attention. So it's another time, one more year we have a dengue-like disease. So people they didn't really care about until the pictures of the babies with microcephaly began to surface in the newspapers. That was the time, and there was this famous picture, I think it was an AP photographer of the baby. Maybe it was in the New York Times story, actually. The baby the only way the baby would stop crying was when he was inside this bowl or something, where they were bathing the baby. And this, a bucket, yes, in the bucket. So this was a changing thing, like the picture of the Syrian boy who drowned, the refugee, Alan Kurdi. That was sort of a changing moment.
That's a really good segue to our other panelist who's just arrived, Chris. I assume you're Chris, by the way. Okay, very good. I don't know, maybe. I was encouraging people to...
Some guy they just sent in off the side there.
I was telling people that the first rule of journalism is to sit in the front row. I didn't know if somebody maybe took it so seriously that they just came and sat next to me. But so that's a very interesting point that you made about the power of images and also the power of placement, which is something that I think we all experience but don't always think about. The value of the real estate of being in prime time on television or in the repeating 24-hour news cycle on cable news, or the front page of the New York Times, one of the best pieces of journalism real estate there is. And so one of the things that I'm wondering from you, and one of the reasons we're so interested in hearing from you is hearing from the public health perspective, what the impact of this coverage has been. So we have these images, they're getting people's attention. Sometimes these images are coming out even ahead of the science. You missed it. This is what you missed by being late. These CDC, I don't know if you saw it, but the CDC announced at 5 p.m. today that they've found what they think is a definitive link between, or a more definitive link between Zika and microcephaly than had been found before. And they also were talking about how they are investigating to find out if there are other brain disorders that could come as a result of the virus. But so these facts are just emerging now, but we've been talking about Zika for months. So I'm wondering, from your perspective, you're sitting in your office or in an examining room and you see an image like that come across TV or the front page of a newspaper and you know it's going to get people's attention. Is that a good thing? Is that a good way for people to get informed? And in this particular case of Zika, how do we do, Doctor?
So first of all, thank you. And I apologize for being late. I had calendar issue apparently, and it's interesting because I was just coming from clinic and actually was providing consultation for travelers who are trying to make decisions about whether or not to go to this area, to South America as things are developing. And as I was there and not at my computer, I missed the recent announcement, but I assume it's kind of one of the incremental steps that's taking place as we learn more and more about Zika and the likely connection with the clinical diseases that have been associated with it. But again, those are kind of incremental steps that are taking place, not to take away from the significance of that type of announcement. But the point you were asking about was this kind of extreme, almost shocking picture with a lot of concern associated with it, and kind of the role that plays in public health. And I'd say it's a bit of a double-edged sword, right? You've got circumstances that are taking place globally that are, for the most part, ignored or not part of the 24-hour news cycle. For example, many of you may or may not know that there was a similar, albeit much smaller and more contained outbreak in French Polynesia preceding the problems we've been seeing in the much larger populations of South America. And while I kind of troll the infectious diseases and public health notification listservs, et cetera, so I hear about these things, but there was, I dare say there was nothing in the press during that time. And so to get funders or get people worked up to actually prepare and really develop a full-fledged, highly invested public health response, one needs, I think these days, the media, because it's a part of that tool. Now, with that comes the potential for misinformation to come out as well, and that's where the balance of that is always how much are you kind of bringing up excitement and concern to a degree where beyond which it is helpful. And that was always the balance with, which was, I think, very prominent that we were dealing with in the Ebola situation, where the really fearsome pictures and information we were receiving there just had a tremendous fear associated with it. Here we have and there we can talk a lot more about this very unique epidemiology, these unique clinical syndromes, a vulnerable population that's very different, and it's delayed. You don't see the outcome until 6 months, 6 months after the outbreak, when the pregnant women who are being infected are manifesting that. So it's a little different.
So
yeah.
So one of the things that I think you touched on there, and this is something that we definitely saw in the Ebola epidemic. Ebola was already a problem. It was raging in Guinea, Sierra Leone, Liberia, not getting a lot of attention in the United States, even though it was being covered somewhat. And I have no idea actually the amount of news coverage at all in the United States about the epidemic in French Polynesia. But one interesting thing in terms of the locution of there being no coverage, I think this is actually a really interesting thing, because this is something that my friends and I have been arguing about on Twitter, especially over the last couple of weeks with regard to a whole bunch of different things, is that I find sometimes we get very annoyed as journalists. I'm sure Simone and Patricia can relate to this, when people say that why has there been no coverage of this? And people are often like pointing to a news story as they say, they're reading a news story in the New York Times and saying, why isn't this being covered? But I've learned over the years, as I sort of take a deep breath and step into sort of longer form things than I was doing before, that I think that sometimes what people mean by nothing is either not enough, or basically, why am I not being inundated with this information the way I'm being inundated with all of these other stories? Why do I hear about Donald Trump 4 million times a day, and I've heard about this only once? But it raises an interesting question, because with regard to the Ebola epidemic, and I think we're seeing the same thing with Zika, particularly, well, I think this is true anywhere in the world, but from the perspective of the United States, Ebola starts getting a ton of attention. If you look at the mentions on social media, the Google Trends, the moment that it spikes in the United States with regard to Ebola is when the first patients are being transferred to the CDC in Atlanta. And people in the United States, if you look at the social media map, people kind of react as if there's been a massive Ebola outbreak in the United States. And that's how people are thinking about it. Even though this epidemic has been going on for a while overseas, it's a problem overseas, and that's really where the problem is going to stay. They pay attention to it when it's here. The same thing happens with Zika. So I had Zika. And one of my friends actually, I don't have a problem calling her out because I don't think she showed up. But when I was mentioning this event, she said jokingly that she didn't want to come here because she didn't want to catch Zika from me. I assured her that it would not be that type of event. But this is a real concern in terms of the way that people assimilate this information, right? People are afraid. I know somebody who's going to Guatemala on a mission trip. They're going to come back. Am I going to get Zika from them? They talked about this on the Diane Rehm show today, and somebody called in from Michigan, worried about possibly getting it from his, I think, sister-in-law. They don't have Aedes aegypti mosquitoes in Michigan. So the question is, it seems sometimes almost impossible to get something to go from the level of, okay, there's been one or two stories, but not that many people are paying attention to them, to the top of the news cycle, the front page of the newspapers. This is all that we're talking about for a day or several days or several weeks. It seems that what's necessary often is to convince people that this is an imminent threat that's about to happen to them, themselves, their children, the people around them. Even if we know as journalists that it's really not. So first of all, I want to pose the question to you, Simone. You're on the foreign desk of the Times, and of course, this is a story that's being covered by several different parts of the newspaper. So I know that, like, you and Don McNeil probably have different perspectives. Catherine St. Louis probably have different perspectives on how to cover this. So, but I'm sure that as a foreign correspondent like me, you wrestle with some of these same issues. So how do you deal with the fact that or do you agree with the statement that Americans will only sort of care about the reporting that you're doing down there at this level if they feel that this is going to be a threat to them personally? And how do you deal with that notion when you're actually producing your coverage?
You know, I think in a sense it's a given that some issues are going to resonate more in the United States or in other parts of the world and in wealthy industrialized countries if people feel like their lives are going to be imminently threatened by something. Quite honestly, I think in Brazil, I think there was a sense of surprise that Zika actually took on this sort of global dimension as a news story. I mean, for several weeks running, when not only the New York Times but an array of other international news organizations were focusing a lot of resources on Zika. You know, there seemed to be more coverage internationally of the virus and of its how it was affecting people in Brazil than there was in Brazil. And I think the government was caught off guard by this. I think they felt like they came under pressure and scrutiny over their response, and in a sense they had to mobilize faster. You know, and you know, I think some of what happened was really valuable. I think it exposed flaws in Brazil's, you know, preparedness to deal with not just new viruses that can leak from one part of the world to another, which is you know, Zika exemplifies that in this really frightening way, and how it can, you know, really start wreaking havoc on a vulnerable population that doesn't have immunity to it. But you know, existing viruses also, dengue and chikungunya, which are doing a lot of damage in Brazil right now. I mean, there's an H1N1 outbreak in São Paulo that has killed more than 20 people in recent weeks. And I mean, you know, here in Rio, I just you know, was you know, taking my kids walking near a health clinic, and there's a line around the block for people trying to get vaccines against H1N1. So there's a lot of concern about that right now. But at the same time, you know, with these mosquito-borne viruses in Brazil, there was, you know, there was almost like a sense of surprise in Brazil that, wow, and you know, in the U.S. decades ago, there was this effort to install screen doors on homes, which is something that you really don't see in Brazil quite yet. So there's this whole debate over whether, Brazilians can adopt some practices like that. And there was also some interesting discussions over like the history of Brazil's battle with Aedes aegypti, the mosquito that's thought to be the main vector for transmitting Zika. Many people, myself included, were unaware that Brazil had waged a decades-long battle against this mosquito and had won back in the 1950s. This was over fears of a different virus, yellow fever, at the time, and the soldiers were going door to door. It was very similar to the situation that you have today in Brazil. And then there was this resurgence of the mosquito back in the 70s. And since then, it's, this is just an insect that's so incredibly agile and it can adapt so well to human environments, especially the type of cities that we have here in Brazil and in other parts of Latin America. A lot of, trash that's not picked up, discarded tires, places where water can accumulate, or these are the perfect breeding grounds for Aedes. So I think there was that initial sense of shock that Americans so interested in this virus that was not affecting them directly at that time, I think it caught people surprised. But I think it also led to some positive outcomes here. I think, especially among the researchers that I talked to, the epidemiologists, they're clamoring for more resources and for more attention to this. They feel woefully underfunded and neglected in a sense. I think the CDC's new information today really helps to legitimize what they've been doing for months. Their research is very, I think, outstanding research that's been done by Brazilian researchers at Fiocruz and other places in Brazil over the past year.
Yeah. I'm sorry, I didn't mean to cut you.
No.
Yeah, no, I mean, for me, it's been very interesting as well. I mean, it's been known for a long time, as the common phrase goes. I mean, the mosquito is the deadliest animal known to man. Hundreds of thousands of people a year die of malaria. The numbers are tremendous who contract dengue fever. Chikungunya is also a fairly recent arrival in the Americas. When that came through, that was a horrible, it's still bad, but it's a horrible, debilitating illness. In a place like Haiti, where I spend a lot of time, where I got Zika myself, when chikungunya came through, it was a much bigger problem than Zika is currently perceived to be. Now, it may be because women who've contracted Zika have not yet started giving birth in large numbers, but because chikungunya is so much more of a painful disease, the word means basically the curled person, the curled man. People develop lifelong arthritis, pain on the soles of their feet and their hands, like they can't work. And it had huge economic ramifications. So these have been huge problems all over the world for a very long time. We've been aware of them. And yet today it was announced that Vijay Singh, the golfer, is canceling his trip to the Olympics in Rio, which I think is something that we should talk about, what the impacts are going to be on Brazil, things like that. But of course, he didn't cancel it before because of dengue. There were mosquito-borne illnesses before. I don't know him personally, but he identifies as a man who is not pregnant, I'm fairly certain. So it's not really clear why this would have gotten his attention and gotten him to decide not to go. So, Patricia, one of the things I was going to ask you is, first of all, is this just a problem with us Americans? Like, are we the only ones who are so self-centered that we need to know that the news impacts us directly and we don't care otherwise? And what kind of attention are these issues, especially of women's health? I know there's been a huge debate in Brazil over abortion and access to contraception. Are people still talking about that in Brazil now, or has that kind of been subsumed by the by the political turmoil and the possibility that, do you guys still have a president, by the way? I didn't even check the news this week.
As of now.
So the possibility that could change. So is the same thing necessary in Brazil? Do Brazilians need to feel that this impacts them personally, and how are they dealing with this?
Absolutely, yes. I was the U.S. correspondent for a big newspaper here for 4 years, and I had a friend. He used to say we were going to cover something very specific to America, and then my friend would go, "No one wants to read about this in Rio beaches. Why would I care?" You know, so it's, I mean, until it gets really close to you, people won't start paying attention. And having said that, here in Brazil, the huge Zika outbreak was between January and April last year. And then in August, July, the first babies with microcephaly started being born, right? Then right now, there's a big decrease to the extent that we have trustworthy data, which is a big if. But anyway, there's a big decrease in the number of cases because there's two hypotheses for this. One, maybe some of the people are immunized in the Northeast. And second, there's under notification of cases in the Southeast, because the understanding is that now this outbreak sort of migrated to the Southeast, which is where the Olympics are going to take place, in Rio, right? So this is one thing. And the second thing is, at the same time, the coverage decreased. It's almost inversely proportional. The amount of coverage in the US growing and here decreasing. Because, as Simone was saying, H1N1 is the new outbreak. So people, I was online for 5 hours to get my son vaccinated. People, they're only talking about the impeachment of the president and H1N1. So they just totally forgot about Zika. Now, going to your second question, abortion. This was a huge and is a huge discussion. There's a suit, not sure if that's the correct legal term, going to the Supreme Court. It's going to be examined because in Brazil, usually abortion is illegal. The only way you can get an abortion is a legal abortion in a public hospital, for instance, is if you were raped, if your baby doesn't have a brain, or if it's life-threatening to the mother. Other than that, the only way to get an abortion is go to a clandestine clinic, to an illegal clinic, a private clinic. And only people who have a lot of money can do this. So basically, poor suffer. So people started to discuss that Zika should be one of the cases under which there are legal abortions. And this is an ongoing discussion. This triggered other moral dilemmas. For instance, I'm a pregnant woman. I got Zika, I got diagnosed. I won't know if my baby or my fetus was affected until it's after the first trimester. You won't be able to detect malformations in the brain. So, and you mentioned the CDC just announced a definitive link between Zika and microcephaly, but we still don't know what's the percentage of the pregnant women who get Zika that their babies actually develop Zika malformation syndrome, as they are calling it. So basically, you have to do a preemptive abortion. You say, I got Zika, I'm pregnant. There's a chance, and I don't know how large is this chance that my baby is gonna have malformation, so I'm gonna get an abortion. So it's not a simple discussion. It's a very, and it's ongoing, yes.
Yeah, one of the interesting things about the Zika epidemic compared to a lot of others, I'm thinking of Ebola specifically, is that in almost every other epidemic, public health experts are usually cautioning that travel bans are a bad idea, they're not effective. In the Ebola epidemic, for instance, the idea of travel bans was used as a political tool. People who politically in the United States argue for closing the borders on a daily basis anyway, we're using this as yet another reason to argue for that. And the response from public health officials was, generally speaking, closing borders doesn't work. People find ways across. You just force people to do it illegally, and diseases don't respect customs officials anyway. But in this case, it's different. I mean, I'm looking right now at the release from CDC, and they said at this time, CDC is not changing its current guidance as a result of this finding. Pregnant women should continue to avoid travel to areas where Zika is actively spreading. So, and if a pregnant woman travels to or lives in an area with active Zika virus transmission, she should talk with her healthcare provider, which, by the way, is going to be very difficult advice for the U.S. citizens in Puerto Rico who are already living through they don't have to go anywhere already. So you were saying that you have, this has been the big question that you've been getting. So first of all, what are you telling people? Because I'm sure some people in the room are wondering as well. And in terms of the messaging in the media, is this the exception? Are we right this time to be talking about travel bans, or is this still something that we should be avoiding?
I've been receiving questions throughout the entire epidemic as people I'm either known as a family member or a friend or as a physician who's related to someone who's traveling to the region, and it's an opportunity for me to echo the message that's put out by CDC. It's not that they are 100% right, and they're not going to claim that they are 100% accurate either. They're providing the best guidance with the amount of information that's available at the time. And again, if they are communicating well and working with the media, I think in a productive way, they are providing serial recommendations that are becoming more appropriate to the circumstances data become available. The point you make about well, let me answer that. You asked specifically, what am I telling people? Again, I'm pretty much echoing the CDC guidance. Pregnant women is where most of the questions come up, and that seems to me to be fairly straightforward. This is a group who's not being banned from travel. They can certainly choose to travel if they wish. We're making a recommendation that they choose not to travel. And to my knowledge, we're not even putting in place screenings, asking people, are you pregnant when you travel, or anything like that from a public health customs level screening. So it more is just echoing that advice that if you are pregnant or you're seeking to become pregnant or potentially going to become pregnant while you're traveling, it's something to take into consideration as you're buying your tickets. Now, I've had others who had questions because they had members of their family who were ill. They were doing a special trip. The trip had been planned for some period of time. Should they take their celebratory trip for the child who just made it to his 18th birthday, having just gone through chemotherapy? Is this something we can do safely and feel comfortable about? And, those kind of you have to nuance the answer on that one. Well, in that case, I said, if there's any. I said, I don't have any reason to tell you not to go based on the information I have about the disease, but if there's any reason that it would give you concern, that's a time of joy and celebration, and anything that's going to give you great angst is going to detract from that. So my advice there was, you're going to have to weigh the information as you see fit.
Yeah, another issue with travel messaging, as I've seen it in the news and from public health officials, is it often sort of takes for granted that the poor, people from poor countries, people who can easily be identified for racial or other reasons as an other, are the ones that we're supposed to be keeping out. One of the great examples of that irony playing out in a horrific way, of course, was Haiti. Deborah mentioned the cholera epidemic. So the source of that was clearly indisputably at this point United Nations peacekeepers who arrived in October of 2010. By the way, we're not even responding to the earthquake, so it just had nothing to do. Just forget the word earthquake when you hear the word cholera in Haiti from now on. Please do me a favor. But that's one example where responders were very much concentrated on the earthquake survivors. Oh, I just said it. Earthquake survivors and people who were living in displacement camps. Basically, the Haitians themselves, they were thinking, okay, these are poor people, they're dirty people, they're going to generate this disease. When the disease that was introduced into the country and has now killed 10,000 people in Haiti and is still killing people today, was introduced by foreign responders who are part of the United Nations system. So that's one thing to keep in mind when you think about people moving around the world. But so to put you on the spot, Simone, and I guess I could be asked this question myself, but fortunately, as I am most comfortable doing, I'm the one asking questions today. do you communicate with public health officials? To what extent do you check these things out? And when you're making ultimate editorial decisions, to what extent do you take their advice into consideration versus your own journalistic instinct?
Do you mean like in terms of like diving into a place to start doing reporting, or in terms of like what measuring, gauging whether a story is worth being covered?
Well, I suppose both. I mean, but in terms of like the editorial decisions about like, so what are we going to say about this? Because people don't know the conversations that go on closed phone lines and behind closed doors. If you get advice that says, do you get advice from health officials that say you should report this, you shouldn't report this, and then how do you weigh that when you get that advice?
Yeah, I mean, absolutely. One of the hidden strengths of the New York Times is that we have this amazing staff of correspondents in our science section who I've been working to, collaborating with throughout our coverage of Zika. And they're so incredibly well sourced in the U.S., whether it's with the CDC or with other specialists who focus on these viruses and on other public health threats. Here in Brazil, it's really been fascinating for me. It's sort of been a discovery in recent months, this sort of disconnect, I think, between incredibly talented and driven public health researchers, officials who are like on the front lines, who are sort of solving this mystery almost in real time, and then the public health system itself, where most people are being treated in public hospitals, which, I mean, the conditions are just for the most part deplorable. So you have these world-class research institutes where people are doing this cutting-edge work, and then you have just these heartbreaking scenes on the ground in Recife, the center of the city up in northeast Brazil, which was the epicenter of the outbreak. Just these hospitals which are literally crumbling, and just the lines of women who are there in the waiting rooms to be attended to. And some of the doctors there are fantastic. They're doing amazing work, but the conditions that they're working in are just, I think, a reflection of one of the big challenges that Brazil still faces in improving its public health system. Sadly, I mean, one of the major reasons for the political upheaval that the country is going through right now is, it's just this array of corruption scandals that are hitting almost every major, political institution in the country. And the health system is also vulnerable to that. I mean, in Recife, in December, when, the month when Zika was really surging in terms of like this huge increase in microcephaly cases, there was this astounding scandal with this state-owned company that was created a few years ago to manufacture plasma, where you actually had the president of the company, his luxury apartment was being raided, and police were entering into it, and someone, I don't know if it was him or someone else in the apartment, was throwing out actually wads of cash out into the sidewalk, seeing, apparently these ill-gotten gains. It's just one of those, Brazil's a big country. It's more than 200 million people, and it has, these incredibly talented people who are working within the public health system. At the same time, you just have a lot of waste, unfortunately, a lot of graft. And so, I think, the officials at the helm of it really have their work cut out for them.
Yeah. So I think we should.
Can I add?
Oh, I'm sorry. Yes, please, go ahead.
I just wanted to add, because Simone was saying about the reason I think it's going to be, and I hope it's going to be much less serious, the Zika outbreak in the US, is the conditions are so different. For instance, in the same state, in the Northeast, which is the epicenter of the outbreak, I was in the countryside of the state, and in one of the hospitals that was supposed to be a reference treatment center, One of the mothers I interviewed, she took her baby who had microcephaly, she took him to the hospital. And it's not that they didn't have a pediatrician, they didn't have any doctors. The baby had seizures and she was waiting for hours. So this is the kind of treatment, this is the kind of health system that you have. And this is, fortunately, that's not something you're going to have in the US.
We do have problems with that. Well, you were going to say
Yeah,
something.
I was just going to say, I don't want to take anything away about what's being discussed regarding the situation of the health infrastructure in Brazil and the disparities within the various states, et cetera. But we're dealing with a situation with a disease that right now is not treatable at its etiology. The Zika virus, we don't have a treatment for. We don't have a vaccine for. We don't have a treatment for the consequences of. We support people who have Guillain-Barré syndrome. We try to provide some support for kids with microcephaly, but the answer there isn't going to be a better tertiary healthcare system. It's going to be kind of fairly mundane public health response, communication about protecting one another or protecting oneself from the mosquitoes, the Aedes mosquitoes, get rid of standing water, provide opportunities for people to get DEET and protect themselves during their pregnancy. Those are going to be the mechanisms we have currently available to constrain the epidemic, the scope of the epidemic.
So I want to let people start asking questions, and you can do so in the room. And if you are one of the people watching at home, there's actually several hundred people watching this right now, and you would like to ask a question, you can do so in the comments, and hopefully my internet connection will stay up, and I will be able to answer it. Or you guys can just keep saying hi to each other, which seems to be the main thing that you're doing. Who had a question? This, by the way, is why you sit in the front row, for future reference.
Hi, my name is Christine Fulch, and I am in cultural anthropology here and in the Global Brazil Lab. And so I wanted to bring in some of the global questions for me. So one is, Zika is a sub-Saharan African disease from like the 1920s or 1930s. We've known about, 40s. Oops, sorry. Well, 1940s. So that is to say, not 2014. And so I guess one of my questions is about Zika not in Brazil, and a little bit more about why now? Is it because Brazil is actually, alternately the world's 6th or 7th largest economy? Is it because it has the research infrastructure that Simone was referencing? It like a little bit more about. Or is the strain that maybe came to Brazil through French Polynesia, is it that one has these incredibly detrimental effects as opposed to other strains of Zika don't quite produce the same health effects? So that's one question, a little bit more about Zika globally and why now this becomes an issue. The second question I have is actually a forecasting question in a different direction. So the World Health Organization, but sort of the Central American version, has urged people, and so I've been following the news in Spanish, particularly because Zika crosses the border into some of the places I study, and there have been strong urges to postpone pregnancy for 2 years. The thing that I'm not hearing is what happens when you postpone pregnancy for 2 years, 10 years out, 15 years out, 20 years out, where you have 2 years of no kids in school, 2 years of no kids, no college students. I mean, this is like, is there any thinking about what happens if we actually pause, like what this does to population curves, et cetera? So
I'll throw that to Patricia. Have you found answers to? Thank you very much for the question. Have you found answers to these questions in your reporting? Basically, I guess why Brazil and what happens now?
Well, I'm going to start with the second question. I think the only people who are postponing pregnancies are the very educated people, like higher income women. There's no such thing, this conversation doesn't get to the poorer neighborhoods. At best, you get these people using bug repellent. That's at best when they have money to buy it, because it's not being distributed free by the health public system. So I don't think it would have an impact in the birth rate. That how you say it? Because the poor population, this message doesn't get across. That's my opinion. I might be wrong. And the first question, I think maybe Doctor, he would be better equipped to answer in terms of how the new viruses go from one place to the other.
I'd be happy to. We've had a series of events over the last several decades that we kind of throw under emerging infections, and they seem to be occurring with greater and greater frequency. We've highlighted a number of these situations. None of these organisms respect borders. It's a globalized world in that way. And there are many things we are doing as our societies evolve that facilitate the transmission. Be it, we can make our way around the world in a day. We have great transport of containers, and our economies are global, and that facilitates it. We have the movement of to and from of people from rural areas to cities and back out, and that allows for the acquisition of a new virus, taking it into a city and back out, and that's what we saw with the Ebola situation. And whether or not that's really what's happened here, where you had this great susceptible population with the relevant vector in Brazil, it probably is. There's some element of that. Now, whether or not there has been change in biology of the virus itself, early data suggests that there's not major differences between the virus that actually was being transmitted in 1947 and that which is being seen now. Now, that said, there was a big change in 2007 when things moved out of its, we'll say, sub-Saharan confines and really moved into Asia, and there seems to be some increased capacity for transmission during that time. But it also could be there are changes in the vector as well. So there's the virus where things could be changing. There's the vector, the Aedes mosquito that could be changing, or it could have something to do with just the susceptibility of those individuals in Brazil as well. And by this, I mean and this gets to where we're talking about the severe outcomes that we're seeing both in children and in adults. There are other similar viruses that are transmitted in other parts of the world, throughout Africa, throughout Southeast Asia, that may modulate the response, may make it better, may make it potentially worse. And so we need to have better understanding of the host, us, the vector, the bug, the virus itself, and we're learning all this. There were 100 articles published on Zika in our literature, in the medical literature, up until basically January of this year. Now there are 422. So you can review the entirety of the literature on Zika in a couple of nights, flipping through. So we're learning a ton, and so we need to understand. We'll have to kind of really dig in over the next months to years. But while that's going on, we need to be developing, smart, intelligent, thoughtful public health responses, and that has to take into account kind of the human element, the cultural element. That who are the people at risk, and how do we protect them?
Yes.
This issue of travel, I just want to come back to it because it affects every Duke student, and the CDC recommendation. So we know by July there'll be 30 states in the U.S. with endemic Zika, right here in the U.S. We know that almost every Asian country has found Zika in the last few weeks. So we have a really interesting question here about travel and what to advise people, because if we tell people don't travel to a Zika infected country, and we have it in our own yards here in Durham. Why are we giving that recommendation? So just in terms of the media, it's something to really, really think about. Secondly, we know there's sexual transmission much more than we thought. So is it okay for men to travel and not pregnant and not women? So I just think the CDC has a lot of thinking to do, and we all have a lot of thinking to do about how we're going to communicate this over the next few months as the weather gets warmer in most parts of the world. It's a very big, one of the biggest challenges I see for the media over that we've ever had in health, because frankly, I don't know where there won't be Zika. I mean, in cold climates in Canada, probably not, and on the West Coast, we probably don't have the mosquito in most places. But I think we're going to be faced with an incredible challenge on how the media is going to communicate about Zika. And I think the CDC recommendations are fine, but I don't really think they help us. So I'm on the committee that has to decide whether Duke students can travel this summer. And how can we ban a student from going anywhere? What we need to do is to help them protect themselves as much as they can, and every man and woman, since men can transmit the virus. I think it's an amazing challenge we're going to face in communications.
Did you have something you wanted to
Yeah, I mean, you asked.
I'm Mike Merson. I run the Global Health Institute. So.
I don't want to monopolize because you actually brought this up as a media question, and I agree with you 100% that this is a very complex situation by virtue of who the at-risk persons are and these unique mechanisms we're identifying for transmission. We have the very effective means of vector-borne disease. It may be overstated, Mike, that we're going to have rampant Zika throughout the United States. I think that we're going to have, if that were the case, we're basing that on where the mosquito is, but almost all of which are imported. Right, but dengue was similar, and we get local transmission. I think we will have local transmission. I think it'll be focal in those areas really which are in our country, which look very similar to the regions of Brazil where the outbreaks have been bad. Those are the areas where I think which are our most vulnerable population, and I think that we do need to have concerns for our less developed areas of Florida, for example. I don't know that I'd be really cautious about how we advise our students. We're going to be cautious about it anyway, but I would comfort them, and I think that the advice that we're getting from CDC is appropriate and still is targeting, principally the pregnant woman issue. Now there are rare case situations where there can be more severe manifestations, but there also are many other diseases out there that are potentially they're exposed to. So I would build it into the overall discussion about protecting oneself when they travel, until we hear that there is, and we may learn something else differently that would change how we're educating folks. But I would be pretty consistent at the moment.
Yeah, go ahead. Please.
Just such it was a real turning point when the CDC issued its travel guidance in terms of covering the story for an international audience, because it suddenly elevates the subject in a way, makes it much more prominent, and it also elicits a range of different reactions, not just in Brazil but in other parts of Latin America that receive a lot of travelers from the U.S. Brazil's sort of an exception in that it doesn't have as well developed a tourism industry as, for instance, Mexico does, or countries in the Caribbean. But still, I mean, those travel warnings can be viewed as sort of almost like a quasi-colonial type of advice. I mean, people are saying, well, wait a second. You have your own health problems right in your own backyard, literally. What about Houston, or what about Miami? What about Puerto Rico?
What about Flint?
No, I mean, I was, when the CDC issued its guidance, I mean, of course, Rio is about to host the 2016 Olympics in a few months. So I spoke to members of the president's cabinet about how they were viewing things, and they immediately sought to play things down and to say, oh, well, it's going to be the winter months in Rio, and there's, the risks are going to be much lower than at other times of the year, and this is happening up in northeast Brazil, this isn't happening in southeast Brazil, when in fact there's like a debate that's raging over the numbers that Patricia mentioned. I think just a fascinating discussion whether Zika is being underreported here in Rio or in Sao Paulo, the country's two biggest cities. But it's just a really, the issue of travel guidance is just a very delicate issue. I know that the CDC through members of the U.S. government, they reach out to their counterparts in parts of Latin America. Here in Brazil, I mean, they warned people in the Brazilian government that this was under discussion and that such guidance was imminent. So it's a very, very delicate issue.
Can I ask a question?
Yes. Yeah.
I wanted to ask a general question. For instance, if you're not a pregnant woman traveling from the U.S. To the Olympics in Brazil, if I'm not wrong, there's a higher chance of you getting dengue virus than Zika virus, and dengue is much more serious than Zika virus. Wouldn't it be advisable to also talk about dengue virus, or put it into perspective, or I don't know?
I think maybe we have so much practice now talking about dengue in this country, it's kind of a hard habit to break.
Yeah, I mean, it's a great opportunity to talk about all of these viruses and to highlight the issues about vector control. In particular, it's useful that all three of those viruses we've talked about are transmitted by the exact same virus, which is our mosquito, which is actually a different mosquito than transmits malaria and different than what transmits West Nile virus here in the United States. So each of those has kind of a unique ecology. But from a public health messaging standpoint, preventing being bitten by mosquitoes as best you can, as well as implementing, smart vector control methods and monitoring your mosquito populations is that's a good, useful message that has lots of benefits. And I think in public health, we always look at, if you're going to be investing money or messaging in one part, what are the added benefits of this? Our whole response to bioterrorism and biodefense, you're looking for the public health added benefit is part of that. So I think you want to do that. That said, I may take a little issue with you about the statement about dengue and the severity of dengue. The primary disease of dengue is usually more severe than Zika, which is typically very mild, but the severe manifestations are quite infrequent, and deaths are actually extremely uncommon, although it can happen. The uniqueness of the Zika circumstance does put it in this very kind of different clinical epidemiological situation that we have to consider, and it's very difficult to study because of that. It's very difficult, I think, to message about, because it's the immediate disease is not, or the disease is not, acute disease is not immediately manifesting the problem we're really worried about, and that disconnect in time is tricky to deal with.
I have to say, having had both dengue and Zika, I highly recommend Zika.
Ah, very good.
Lighter body, much better finish. Yes, there.
Hi, I wanted to follow up though, because we kind of glossed the sexual transmission question. I mean, is it that we know that it's much, and we've talked almost exclusively about mosquitoes. Do we know that it's really mostly a mosquito issue, or is it that we don't know enough about sexual transmission? Do we have a sense of, or is it just a messaging issue? Do Does the media, does the US, does Brazil not want to talk about it as a sexually transmitted disease that we know is transmitted via semen, but we don't know that women can transmit once they've sexually? I mean, what is, I'd like to know more about it. Is it just a media issue, or is that something that the medicine doesn't know yet?
Well, I want to spin it as a media question. Here we are. So I mean, Simone, has that, how have you dealt with that question? Do you feel like you are putting more emphasis than you otherwise might on mosquitoes because of the issues about talking about sex, or do you think that they've both gotten their fair amount of time?
You know, it's actually been a fascinating aspect of the coverage. A colleague of mine, one of our science writers, Don McNeil, was one of the first to highlight the sexual transmission of Zika. And what's really interesting is that came from originally from a researcher in Colorado who returned from a trip to sub-Saharan Africa and got Zika and transmitted it to his wife and wrote about this, I think, back in like 2008 or 2009. And then it was sort of lost in the medical literature for years because Zika was such an obscure virus for so long. And then lo and behold, you know, there were these cases that were detected in Texas, in Dallas, earlier this year, and it was found that sexual transmission is much more common than people had known. So I think it's just something that it's one of those mysteries that we're still just trying to find out, as much as we can about. It may very well be underreported in relation to the mosquito vector. The overwhelming attention has been on Aedes aegypti. There's some new questions now whether Aedes is the only mosquito vector that is transmitting Zika, whether other mosquitoes are also capable of doing so, and whether that may be exposing flaws in the way that Brazil and other countries are trying to combat Zika by focusing just on one mosquito and not others.
Oh, sorry, I didn't mean to cut you off.
No, go ahead.
I want to ask you a question online. It's shown up in the comments field here, and people have been talking about it a lot in terms of the coverage. So I was just wondering if you could address it briefly. There are a lot of people who talk about the possibility that Zika could have its cause in some kind of toxic chemicals or medical experimentation or I don't know what. In your coverage, is this something that you have considered, or do you get feedback from readers asking why you haven't covered this more? How do you answer people who bring that up as a topic?
Absolutely. I mean, email after email from readers, reader comments, questions for our editors. Hey, why aren't you looking into the possibility that larvicides could cause microcephaly, or that there could be another cause that is not Zika. So we looked into this very seriously. Of course, early on, and I'm not an epidemiologist, but I've consulted many experts on this issue. All of the research suggests that those alternate theories, are erroneous, and that it is in fact Zika, as the CDC has confirmed today, and as Brazilian researchers have been claiming for many months now. And from what I understand, it sort of raises an interesting question about the arc in the way in which these viruses are often reported. When a new virus, sort of emerges on the regional stage, on the global stage, there often are, an array of different theories about, it's not the virus that's causing this, or there's over-reporting of it, or this is all a big hoax, or this is, you're making a mountain out of a molehill. So it's our job to look into those possibilities with as much transparency as possible, and to determine if those claims are correct or not. I think it's entirely valid for those issues to be to be in the realm of discussion, and it's our job to get to the bottom.
We ran a story. At one point, there were so many rumors going on and questions from readers that we ran a story with myths and dispelling myths. So the main ones, the one about the pesticide, then there was one saying that kids under 7, if they got Zika, they would also have neurological damage. And the one that really, really annoyed me and us all was about vaccines. At some point in the Northeast, they started saying that vaccination was causing microcephaly.
In response to this bit of discussion, one, I wanted to say, in reference to Mike's earlier question and the sexually transmitted part, that's another great opportunity for us to educate our students about the benefit of condoms and so forth. So it's a nice another way to take advantage of a public health messaging. I did want to compliment what I see as maybe a maturation of the public health media relationship over the last few outbreaks. If I kind of look at time that way, it used to be during SARS and earlier, and even into H1N1, there was kind of a lag, maybe in some of the public health messaging getting out. Rumor would come out. Rumor would not necessarily be contradicted or corrected in the papers. Boy, the improvement I saw during, particularly I'll credit the Times with Ebola. I went to their resource pages on Ebola, and it was a tremendous work. It's better than the medical literature as a way to kind of keep up with things. They did a great job. And the new thing that I've seen with Zika is just what you were mentioning with the this dispelling of myths. And I've seen a number of different outlets kind of put that information out there. And CDC always has frequently asked questions, and they try to do that. But I don't see that active role taken by the media as much. And I just wanted to give credit where I really thought it was due, where I've seen that approach lately.
I have a question, though, to return to the sexual transmission issue, which I think is
particularly fascinating. Aren't tick-borne diseases often potentially sexually transmissible also? And don't we as a society really choose certain diseases that are showing up in certain demographics as being sexually transmissible in a way that marks the people who have contacted the disease through sex as somehow or other overly sexualized, hypersexualized, whereas in fact it's really just such a banal physical question of what fluids it transmits to and how it propagates. And so shouldn't we really be teaching having the public think about what sexual transmission or other kinds of transmission mean outside of our ideas about sex, sexualities, genders?
I think it's a hugely important point, and it that our approach to that matured tremendously over the last 3 decades as we've dealt with the HIV pandemic, which obviously is where much of that stigmatization took place, both for sex and then for our gay community as well in particular. But the issue of how to handle, or try to deal with sexual transmission versus the issues related to vector-borne transmission, I guess you're right. We probably don't stigmatize people for going out and walking in the woods without their DEET on, but maybe it's something we can refine in the messaging, and it's something we should certainly avoid is stigmatizing, because that will lead to further reducing our public health impact.
We have a ringer in the room. We actually probably have several ringers in the room, but there's one ringer I know about. Catherine Burns is a historian of medicine who's worked extensively on HIV and at what I've been told to call Wits University in Johannesburg, because I've been assured that I cannot pronounce it, its proper name. But do you want to address this, or did you have anything else that you?
I've been storing up a question about this, and the
last arc of questions allows this. I suppose I've been following the New York Times coverage, and I don't know if you're aware how many people in South Africa are reading this, in Southern Africa, and we've been having very hot debates about the Center for Disease Control. We also have a fairly large Portuguese-speaking community in our city, and there's been very interesting, I suppose, pan-Lusophone discussions. And also South Africa has very similar political crisis going on at the moment, and we have very close ties with Brazil, both for good and ill, around sport, around the Olympics, around the World Cup, around corruption and power. So we have a toxic mix of similarity. But the one thing that we've been very surprised at our university, and we've had journal clubs on this since last October, is why both the New York Times, just to use that as a flagship newspaper, as well as other media outlets, are not seeming to reference or learn from their own experience with the HIV pandemic. And the particular flag has been around abortion and the stigmatization of women's decision-making and reproductive health journeys, alluded to a little bit earlier, but also around sexual transmission and exactly what Deborah said, tuberculosis, the flu, many forms of transmissions are intimate. There could be sexual fluids, there can be coughing, there can be licking, there can be suckling, there can be nurturing. In other words, there are a huge number of human experiences of disease that are transmitted intimately. And we don't talk about, for example, TB or the flu as sexually transmitted, which is one of the ways that it's transmitted. So we know this. And there is 30 years of outstanding journalist criticism, self-criticism, and the work of literary scholars, cultural and performance aesthetic scholars, political economy scholars, but nobody seems to reference this in relation to Zika. We've done our own amateur searches, and we're stunned by it. So it's as if we're forgetting a whole branch of knowledge that journalists were preeminent in creating about their craft. And the Centers of Disease Control created expertise between media and messaging on this. And it's extraordinary that it's not being discussed and shared at a very high level. And this includes the New York Times. So I just, it's really a reflection and appreciation of the work of you too, and of people such as the eminent physician in the room. But it's also, just a view from the South to your South. I have been asking people since I was in Nashville a couple of weeks ago at Vanderbilt about what people are thinking. And every single public health person I spoke to there, including people who are HIV experts, poo-pooed any possibility that there would be widespread Zika issue in the US and made no connection between HIV and Zika. And I think I'm speaking to people as eminent as people at Duke. Not one. I've asked the question to every single public health person I've spoken to, and this morning I did so at the University of North Carolina at Chapel Hill. So I'm going home with the message that there is some kind of a mental block here and that you need our help very urgently.
So yes, thank you for the question. No, so Simone, what's wrong with you, man? Like, what are you? What's going on at the Times? I thought, what's wrong with it?
I get this question all the time.
No, seriously. I mean, can you? I'd like you to address the question.
It's actually probably an avenue of reporting that we should explore much more thoroughly. I mean, just the view from the ground here in Brazil on the issue of sexual transmission is actually really interesting because Brazil, in some ways, is much more advanced than some other countries in the region, than perhaps in other parts of the United States, and that they have an amazing nationwide condom distribution program that is intensified each year in the build-up to annual carnival celebrations, which happen a period that happened to coincide with the surge in Zika cases this past summer here in Brazil. Brazil also stands out in that it has a pioneering program to distribute HIV medications free of charge, which was just an incredible step that was taken about a decade and a half ago in the country. It's a sort of one of those strengths within the public health system that's really quite exemplary, and I think that some interesting parallels could certainly be drawn between, the innovative response to HIV at that time and maybe the missteps in addressing Zika, the slowness in identifying the disease and maybe the missteps in helping people, families with babies with microcephaly now. So it's really, really interesting comment. I really appreciate it.
Thanks, man. There's a question. We'll come to you next.
Hi, you talked a little bit about how some of the public health education messaging isn't reaching the most at-risk populations in Brazil. And I'm wondering if you can talk a little bit about the government response and on-the-ground public health education campaigns that are happening and where you see the missteps and what would be a successful strategy for reaching at-risk populations specifically.
Do you want to field that, or anyone can jump in?
Well, how can I answer this? First of all, there's several things. I think the combating the factor, the mosquito, it's getting better and better. This is something that the messaging, everywhere you go, you have mosquito signs and teaching, how to avoid buckets with water and how to avoid mosquito water accumulation. I think this part of the message, I'm not sure if Simone agrees, it's quite strong. The part that is not so strong, for instance, they announced 7 months ago that they would have an early intervention, early stimulation program for the babies with microcephaly. Nothing has happened. In several of the measures that were announced in terms of helping mothers who have babies with microcephaly or helping pregnant women, for instance, in São Paulo, the government promised to have tests to detect Zika virus in pregnant women. There's no such thing. The only way you can get a test is in private laboratories, and it costs like over the minimum wage. Meaning, no one who's not rich is going to get those tests. And the pregnant women, they're basically diagnosing these women only based on symptoms, which are very similar to other diseases. So I'm not sure if I did answer the question.
I think you highlighted, from trying to assess the efficacy of the public health messaging is very difficult, as you just heard, as we try to look at what the metrics of success are, because again, the downstream effect that you're looking at is months later than what's when the actual infection is taking place. So it has to do with monitoring those behaviors, which takes boots on the ground, which takes a lot of effort to kind of see what people are doing. Those are not difficult studies to do, but there are people need to be out and gathering those data, and it's not and there are a lot of competing interests at the moment. So you need investment in that structure that we alluded to earlier. But it's a wicked problem to try to deal with, just because of the unique clinical circumstances that the disease causes, the unique ecology, and just trying to figure out, is it sexually transmitted 50% of the time, 40% of the time, 20% of the time, versus transmitted 80, 90% by the vectors, and that would then that dramatically affects the efficacy of the interventions that are put in place, whether or not they're focusing on the vector or they're focusing on the messaging regarding sexual behavior. It's a tricky problem to address.
So before we run out of time, this gentleman's had a question from the beginning.
Thanks. This is a question on the media's role. I was struck by, I think it's Patricia pointed out that the pivotal moment was the running the photograph of the child with microcephaly. I'm interested in why that was pivotal. I'm wondering if you might unpack that a bit, because I imagine every day news organizations and photojournalists issue lots of images of children in peril, but for some reason, in this case, it made a big difference. And was it a combination with other factors that made that difference? What are the kind of the cultural valence of that image in Brazil?
Well, there's maybe Simone wants to add something, but I just wanted to say that there was a lot of discussion as to if we should publish those pictures of the babies in the newspaper at all, let alone in the cover of the newspaper, if this was ethical or not, and if we should get, we ended up getting authorization from the mothers, but still, I mean, was that a service or was this just sensationalist? This was a discussion we had, and it took some time for the newspapers to start publishing those pictures, the very sad pictures like the one of the baby in the bucket. Having said that, I think it does have a role in alerting the population, because up until then, people are just ignoring because of some disease up in the Northeast with poor babies who were undernourished anyway. I mean, it's. I don't have a definitive answer because I also agree that there are some ethical questions, but I do think it has a role in finally waking people up for the seriousness of the outbreak.
If I can just add a bit to what Patricia said, I mean, there is just there's something visceral about a photograph of a baby with a shrunken head. I mean, it just brings the story home in a way that that a long investigative article might not. And I think I know that the photographer who took those pictures, Felipe Dana from Associated Press, is an exemplary photojournalist. And he spent a long time with that family, becoming very close to them in the process of taking those photos. And I think just did an amazing service in a way because, I mean, the way in which Zika first emerged in the public consciousness in Brazil was as this, what they were calling in Portuguese, a doença misteriosa, this mystery disease that no one really knew anything about. And it was months and months and months of reporting on what was happening, emergency rooms being filled up with people with Zika symptoms, and then finally identifying the disease, and finally, the connection made between microcephaly and the virus. But those photographs really brought it home. I think not just for an international reader, audience like our own newspaper, but in Brazil too. I mean, it really, I think it reminded people in the more industrialized, more prosperous parts of the country that this is something that's affecting all of Brazil, and it could soon affect you too. So I think pictures are just really powerful in their own way. Just a reminder that even though we're all trying out all of these new multimedia technologies and video and graphics and whatnot, which are great. A real it's just a great example of what photojournalism can do at a crucial moment in a news story.
There was a little bit of applause in the room, though, I think, when the idea of not running those pictures came up, the idea of violating people's privacy or dignity. I mean, I know you're not a photographer. I've already asked you to speak for the rest of 8th Avenue. But, I mean, how do you deal with those questions, either in print, but especially when you're talking about the power of those photographs?
I'll just answer very quickly, then pass on to Patricia. But for us, it's a very delicate issue, especially in Brazil, because there's actually legislation here that governs images of children in the media that's much more vigilant than in the United States and in some other countries. So it's something, and we have a big readership in Brazil, so it's something that we take very, very seriously ourselves. But we have, just incredible photo editors in New York who make the ultimate decision on it, and they went for running the pictures. So,
Chrissy, did you have something you want to add about that?
Yeah, this was part of the discussion, privacy issues, and in the beginning we were not asking. I mean, we would ask people people, do you agree, is it okay to be photographed? But we didn't have a written authorization, and afterwards we got a written authorization. The thing that strikes me, even when I was in Recife, and Simone was there too, at one point, the main hospital that was treating the babies and taking care of the mothers too, they had, let's say, 10 mothers in the waiting room, and they had, I think, like 30 journalists inside the hospital, just, coming up to the mothers and sort of harassing the mothers with the babies. So it's just, it's really, I don't even know what to say about this, but it's something about, I'm not sure if those people were comfortable with their privacy being violated this way.
It was a terrible scene. I mean, it was like a frenzy, making it, I think, worse. They're waiting for hours in this room that's not air conditioned. Temperatures above 90 degrees. It's hot and humid. And they're trying to care for their and you have these news crews from all over the world. You had people coming in from
Korea
and Russia and Japan. It was just like, whoa. And I don't think it was the best moment for our profession to see that. It really wasn't.
Take panelist prerogative and ask a question of my journalism colleagues.
Sure. And I think we may wrap up after
yeah.
this.
We, as public health professionals, we may periodically feel both, totally out of control of what's happening in the 24-hour news cycle. And then yet there are times when we really feel like we're trying to drive the message. And we've talked about how the discussion about Zika has had its peaks and its valleys along the way. Is there any sense that public health messaging, and when we are pushing out our press releases and really just trying to highlight our overriding communication objectives, is that driving the messaging at all, or is it, or those peaks and valleys at all, or do we have any real control over this at all? Or are we totally at the whim of
I'm gonna jump in real fast because actually there's a paper that is, I think, going to be published on Friday by a Duke professor about that topic. Brian Southwell sent this to me, where essentially in the abstract of the piece, the researchers basically found that when public health authorities make an announcement and then we cover it, there is a spike of interest and a spike of conversation. And when public health officials are not making announcements, we don't tend to cover it as much, and there's less conversation. This is the finding.
That's good.
If you can trust Duke University, these are the findings of at least one group of researchers. But did you guys have an answer that you wanted to throw in?
Yeah, I think in the case of Zika, where there was just such intense interest in the story that, most certainly, it's that new information, new papers, new studies, new findings are just crucial in terms of like keeping people into the story and finding new angles to cover. The risk is that it could get lost in the flood of coverage sometimes. A lot of it just depends on timing. I know this is crazy. We're all sort of slaves to the internet these days, but there are quite often several big news stories breaking simultaneously around the world, and I think thankfully for Zika was a big story for weeks on end, which was really exemplary, and so it's just great to get such findings out. I find.
Well, we've run several times over our time, but thank you everybody for coming. Thank you to Patricia, to Simone, to Chris for being here. And don't get Zika would be the other piece.
Produced by Duke University. Online at duke.edu.